Hello, everyone. My name is Ertuza Khalid, and I'm a senior medical student at the University of Iowa. I have always found a special interest in public health and social justice as a hobby, and I try to do what I can in my power to spread awareness about issues that plague our current society. I swear, no pun intended with the recent news. A future goal of mine is to work on educational medical lectures for USMLE Step 1 and Step 2, for which I was planning on establishing a dedicated channel down the road. However, with what has been happening in the world recently involving the coronavirus disease, I think it is important for me to release a video sooner than later. Well, plans always change, they say, right, fellas? So, this is my first ever educational video, and therefore my apologies in advance if the quality is not too great. None of the recording equipment I will eventually be using has yet been delivered. Regardless of all of that, the goal was to provide clear, concise, and accurate information, and I think this video does a pretty good job with that. You guys be the judge. If you guys have any questions, comments, or concerns, please reach out to me via the comment section below, or send me an email with your questions and I will do what's best to answer them as accurately and quickly as possible. Today, we will be talking about the coronavirus disease, which was recently classified as a pandemic by the World Health Organization last week. People have tons and tons of questions, and you all are scared. I get that. Trust me, I do. A small part of me is afraid as well. However, what's keeping me in check is my scientific medical knowledge. The goal with this video is to share that knowledge with you all so you can also have a sense of calm and peace. Before I say anything, I urge all my listeners to please remain calm and please do not panic. The goal of this video is to explain certain things that people are either confused about, or there's a lot of misinformation and misrepresentation by memes and social media and media outlets, which is making you all worried. The quarantining, the social distancing, the stock market crash, wherever you look, it looks like the world is falling apart and the apocalypse is upon us. Recently, the hashtag flatten the curve has been trending on Twitter a lot. It has come to my attention that a massively large number of people do not understand what that means. Many of my patients, friends, and family members have been asking me to explain this concept to them. Initially, I was responding only to those who would reach out and help them explain the curve by eliminating all the epidemiology and medical jargon. But then I thought a video that can reach more people on the wider web would be a better idea. Ergo, this short video is a small attempt on my part at explaining that hashtag, flatten the curve, and explain what exactly it means. So let's begin. Let's start our discussion with talking about what a virus actually is. There has always been this age-old debate of whether a virus is a living organism or not. For the sake of the argument in this video, let's assume that a virus is indeed a living organism. Like all other organisms, including bacteria, plants, and animals, a virus also has a genetic material. In the human body, if you isolate a single cell, you will see that the genetic code is made up of a DNA molecule that resides inside the nucleus. In a bacterium, the genetic code is also made up of DNA molecules, and so in plants. However, when it comes to viruses, the genetic code can either be an RNA molecule or a DNA molecule. That genetic material is what encodes for proteins that are required for the life cycle of a virus and other functions. There are various subtypes of the DNA and RNA molecules, but to make this discussion simple, we will look at the most common types. DNA molecules usually exist in nature as a double helix. What that means is that there are two DNA molecules that are intertwined with each other to form a helical shape. RNA molecules, on the other hand, commonly exist in nature as a single strand. Because of the fact that it is a single strand that forms a helix, these RNA strands can be subdivided into positive or negative sense strands. What that means is that the RNA molecule adapts a specific shape in a three-dimensional space, which gives it a positive or negative sense of direction. So let's talk about this with images. So this is a typical image of a virus. This is the viral genome, which can either be a RNA or a DNA molecule, and this here is the envelope protein on the envelope that encompasses the virus. So if I ask you to draw me a very simple virus, what you would do is take some DNA structure and envelop it in a protein envelope. That's it. That's a virus. So now let's talk about the types of viruses. So the first type of viruses, like I said, the first subclassification is DNA versus RNA. So what you do for that is that you have a RNA virus, which can have a single strand most commonly, and then the DNA virus, which can have a double strand most commonly as a genetic makeup. And then the RNA virus can be subdivided into a positive sense or a negative sense RNA. So if we look at the coronavirus, that is an example of a positive sense single-stranded RNA virus. So it's an RNA virus that has a positive sense because it is one single strand of an RNA molecule that is encompassed in a protein envelope. And that's it. That's the coronavirus. Now you will ask, why is it called the coronavirus? If we go back to this image right here, we will see that the envelope protein has these other proteins that are sticking out of it. These proteins, when you look at the coronavirus under an electron microscope, these proteins give it the shape of a crown, and that's why it's called the coronavirus. One thing I need you all to understand is that coronavirus is not an individual virus like the influenza, aka flu virus, or rhinovirus, which causes the common cold. Coronavirus is in fact a family of viruses and has multiple members within its family. Let's talk about some of the diseases that are caused by coronavirus. Believe it or not, it is one of the causes of the common cold, but as you can imagine, it's not that big a deal. However, more severely, it causes things like SARS, which is severe acute respiratory syndrome. It is also caused by a special type of coronavirus. The second thing it causes is MERS, which is Middle Eastern Respiratory Syndrome. A third type of disease is acute bronchitis. You can imagine all these three diseases are linked to the respiratory syndromes. All of these diseases are caused by different types of coronaviruses, and all of them can lead to something that we call ARDS, acute respiratory distress syndrome. What that means is that the blood vessels in the pulmonary system or in the lung vasculature, they become leaky, and then they cause congestion and shortness of breath, and that is the main cause of death by these diseases. The blood and the fluids in the vessel starts pouring out into the lungs, which causes all the symptoms. ARDS itself is a type of condition that can be caused by many things, including trauma, surgery, infection by bacteria, and in this case, virus. Coronavirus is one of those viruses that happens to cause ARDS. And finally, these respiratory symptoms are the reason that epidemiology curve comes into play. Let me walk you guys through the whole picture and hopefully it will make more sense. For the sake of this video, I will focus my attention in numbers to the US population. However, the same math can be applied to any country on the planet and the results will be replicable. Epidemiologists like Mark Lipsitch at Harvard University estimate that any number within 20 to 60% of adults will be affected with the virus. That is a massive number of people. That's a massive range. The current US population is about 330 million people. Since 20 to 60% is a very large range, let's take a number on the lower end of that spectrum as a best case scenario. Let's use 30% or 1/3 of the population. 1/3 of 330 million is about 130 million people. Epidemiologists and virologists are predicting that 80% of the cases will be mild. That leaves behind 20% of cases to be severe or critical. Out of that 20%, 15% of infected people are expected to be in a severe condition, which means they need to be hospitalized. That's fine. The remaining 5% or so are expected to be in critical condition, warranting an ICU admission. That is where the curve comes into play. If you do the math, 5% of those 130 million affected individuals ends up being 6.5 million people. That means that the area under this graph is 6.5 million people. The maximum number of ventilators that can be put to use in the US is about 160,000. That means we have 160,000 ventilators for 6.5 million people. That is a huge discrepancy in supply and demand. 160,000 ventilators comes up here, the healthcare system capacity. This is also assuming that all 160,000 ventilators are being put to use to treat critical cases of COVID-19. But you have to remember that at any given time, there are hundreds and thousands of people who are not infected with COVID-19, but are admitted to the ICU for other life-threatening conditions and are in use of those ventilators like traumas, accidents, and surgeries. So the healthcare system capacity peaks out at 160,000 ventilators over here. However, the daily number of cases, if this curve is followed, is way more than 160,000. It's expected to be about 500,000 people. However, if you move the curve from this pink one to this gray curve here, this is also 6.5 million people, but you see that it is expected over a very large time on the x-axis over here. So the number of cases that are daily showing up with COVID-19 always stays below this line of 160,000 ventilators. That is the whole point of quarantining. That is the whole point of social distancing. The point is that this is a very infectious virus. So one person is going to spread it to other people. There is no two ways about it. However, if we do proper protocoling, we wash our hands, we keep our surfaces clean, we keep our distance from other people, we do not shake hands, we quarantine ourselves, or we not even quarantine, we just isolate ourselves and only go out in public when is absolutely imperative, one person who may or may not have the virus will not spread it to 10 other people or 5 other people super fast. That will delay the time on the x-axis, which means less and less people will be affected every day, implying that those less and less people will be put on ventilators because they need those ventilators. If they don't get those ventilators, they will die. And those people, when less and less people are getting infected, they will stay under the 160,000 ventilator line. That is the whole point of quarantining. That is the whole point of social distancing and making sure that even though the virus is very infectious, it is very easy to spread from one person to another. When we take into consideration these protocols of lockdowns, we make sure that not a lot of people are getting infected with this virus and less people on a daily basis need those ventilators, and we don't saturate the healthcare system capacity. The daily number of cases stays low, and the hospitals can take care of those patients who are critically ill and who need those ventilators, because if they don't get those ventilators, they will pass on. The grim picture about this is that many of us will be infected, but there's an amazing silver lining. The social distancing is doing two things. One, it's preventing the infection to transmit from person A to person B. And two, even in the case of the spread of infection, it is happening so slow over a longer time span that we do not saturate the healthcare system. Instead of 6 million plus people coming into ICUs all across the country for ventilator access all at once and choking the system to a horrible failure, we distribute those 6 million people over a longer time frame, ensuring that all those patients have access to a functioning ventilator. Expanding the time frame helps the healthcare system to breathe, but at the same time, it gives researchers more and more time to develop vaccines and treatments for this virus. There are many rumors on social media about vaccines being available within the next 4 to 6 weeks. I would like to be hopeful and optimistic, but at the same time, a realist. The way public health works, FDA needs several months of testing before a proper functioning vaccine can be put into a commercial use for the mass public. That is not happening before a year, so at best, we're about a year out from having a functioning vaccine. Therefore, this time since the first case and expanding it longer and longer by social distancing is very, very important. Lastly, let's talk about some graphs and histograms and pictures so it makes some more sense. This graph on the left, on the x-axis, talks about infectivity of previous diseases that we have experienced on the planet, and on the y-axis talks about how dangerous or how lethal a disease was. Things like measles and chickenpox are very, very infectious because one person can give it to 9 other people. However, they're very low on the lethality rate down here. However, things like MERS, which I talked about earlier, the Middle Eastern Respiratory Syndrome, is not very infectious because it only affects one person and one person can give to one more person. However, it is about 35 to 40% lethal. Let's talk about COVID-19. COVID-19 is somewhere in the middle. We don't really know too much about this virus at this point, so it is a range of data instead of one point. But either way, it is somewhat infectious and it is more lethal and more fatal than the season flu. Therefore, infectivity is a bigger problem and lethality is also a bigger problem. That's why it is very crucial that we talk about social distancing and quarantining and only accessing public areas if it is unnecessary. It is absolutely necessary and imperative. To talk about some people who are at risk, people aged 60 and up are on the highest risk. The risk goes up exponentially if you are over 80 years of age. You have a 1 in 6 chance of dying from this disease. If you are over 60 years of age, you have about a 3.6% or 1 in 27 chance of not making it through. Some coexisting conditions that can make the fatality and lethality worse. The most important factor is cardiovascular disease. A lot of the patients that I deal with these days have cardiovascular diseases, and we are taking extra special care in making sure that they do not get infected with the virus. Diabetes is number 2 on the list. Chronic respiratory disease is number 3, which is kind of counterintuitive. You would think that respiratory problems like cystic fibrosis and COPD, these things will actually make you more vulnerable to the disease, contracting the virus, but it's still up there with diabetes and cardiovascular, but it's not number 1. Abnormally high blood pressure is also on the list. Now, mind you, this does not include patients who have chronic essential hypertension, chronic patients who are taking blood pressure medications and their blood pressure is under control. This includes patients who are taking blood pressure medications or who are not taking blood pressure medications, and either way, their blood pressure is very much increased, and cancer is also a risk factor for patients who have cancer are also on a higher risk for contracting the disease as compared to the general population. And one last thing I wanted to talk about with you all were symptoms of coronavirus or COVID-19 and what to expect. You will see on the graph here that many of these symptoms are very similar to other viral illnesses like fever and dry cough and fatigue. You just feel tired, your whole body aches. Fever happens to be the most common. About 90% of patients who have the virus feel feverish. That's why fever is one of those screening tests we are doing in the hospital and other settings to make sure that a patient is not infected with COVID-19. If patients have a fever and an upper respiratory infection, then we do some more triaging and some more confirmatory testing, which is done with the state health department and the federal government to see if the patient actually has COVID-19 or is it just some other respiratory illness. One thing I wanted to add up here is that if you notice that all these patients here, they have a very, very low mortality in that age range. Younger people in their 20s and 30s and 40s have a very low chance of fatality. However, it does not mean that they have a low chance of infection. All these younger patients over here who have a very low rate of fatality from this infection have the same rate of infection to other people. So therefore, whether you're 20 years old or 40 years old or 70 years old, you have to take part in social isolation and social distancing, because no matter what your age, you are equally infectious to other people. So you may be a 30-year-old person who is very healthy and does not have any immunocompromised state and who will hopefully surpass this infection without any long-lasting issues, but you can give it to several other people who are older or who are immunocompromised, and they may not have as good of a fighting chance as you do. So no matter what your age, please take part in social distancing. Please only leave your house when it is absolutely imperative. Again, all of this is not to create panic. All of this is not to make you guys worry. This is only taking place because we need to make sure that we tackle the situation that we have at our disposal right now, and we do not choke the healthcare system for those patients who actually need the help, that they do. Uh, if you have any of these symptoms of fever, dry cough, or fatigue, please contact your local primary care provider or local ER. Do not go there in person, because God forbid, if you do have the infection, you are risking other patients in the hospital and you're risking them to contract the infection. If you have any of these symptoms, please go ahead and call your primary care doctor or call your local doctor and talk to them over the phone and do as they say. I hope this video was helpful, and I hope that this was not confusing at all, and I hope that I was able to calm you guys down and help you guys with many of your questions. Again, like I said at the beginning of this video, if you have any questions, comments, or concerns, you can either reach out to me via my email address, or you can comment in the comment section below, and I will do my best to get back to you on time. And please stay safe out there, wash your hands, do proper hygiene, and please do not hog toilet paper. Thank you.